Moving on to our next speaker, she is Dr. SHEFALY Tandon, is a highly motivated pediatric dentist and having studied from Manipal University and SGT University, she is focused on delivering patient-centric care with the goal of improving quality of life and care in children. She is an experienced pediatric dentist who, after treating young children with extensive tooth decay and multiple dental problems, decided to delve into the root cause of the present generation disease and handle patients accordingly. Her topic for today is functional testings and assessments, which is very important as a layman, or if you are a health coach, if you are a practitioner. We need to understand the optimal ranges, against the conventional ranges that the lab actually gives us. Dr. SHEFALY, over to you. Please enlighten us that what is the meaning of an optimal range, and which is very crucial for everybody of us to understand. Thank you.
Thank you, Dr. Karishma, for this very warm welcome. I'll just share my screen.
Your screen is visible. Can you please maximize?
Yeah. Is it visible?
Visible, yes, it's visible. Loud and clear as well. Please go ahead.
Thank you. Good afternoon, everyone. I'm Dr. SHEFALY Tandon, and today my topic is functional testing and assessments. So before we come on to testings, I just want to give a brief explanation about what functional medicine essentially does, as everyone has already explained. Now, functional medicine is essentially a system biology-based approach that focuses on identifying and addressing the root cause of the diseases while utilizing in-depth blood work and focusing on the optimal values and specialty lab testing. Now, one of the most important things that we see, now based on this picture, if you see that something like depression, now that can be caused by many different factors such as inflammation. And likewise, a cause such as inflammation may lead to a number of different diagnoses such as depression. Now, the precise manifestation of each cause depends on the individual's genes, environment, lifestyle, and only treatments that address the right cause will actually have a long-lasting and an impactful result on their treatment and their diagnosis. Now, the current healthcare model, unfortunately, only focuses on identifying the disease and suppressing the symptoms, either with surgery or with medication, which makes us good at describing the disease, but not identifying the root cause. And while this approach is absolutely essential for emergency care, it does not work quite well in the cases of chronic diseases, which we usually encounter. And this is where we come in, the functional medicine practitioners. Now, we focus on the root cause, which range from nutritional deficiencies and insufficiencies, chronic infections, unprocessed trauma, unhealthy lifestyle, and of course, heavy metals. Now if you look at this, now the tree represents the body and the roots of the systems. Now, if you think of the systems as the roots and the symptoms as the leaves, it is very easy to see that many of our illnesses and conditions actually stem from an imbalance in the roots. Now, what does functional medicine identify? Now, it identifies a few very important core imbalances. The first being digestive, absorptive, and microbiological imbalances, immune and inflammatory imbalances, detoxification, biotransformation imbalances, and neurotransmitters and hormonal imbalances. Now coming on to functional testing. Now, as we all know, that conventional testing is as important as functional testing. But what functional testing does is essentially it helps you identify any kind of health imbalance in your body. Apart from that, it is much more focused on identifying the patterns and health trends that may lead to disease or be the cause behind unsolved and non-specific symptoms. And in addition to that, functional medicine testing tests what is more than routine. Now, this also includes the presence and the optimal levels of micronutrients, lipid subtypes, inflammatory markers, and of course, heavy metals. Now, there are a lot of advantages to that. And the first is they're accurate. Now, a basic panel in functional medicine typically measures well over 50 plus biomarkers, with more in-depth labs which measure over at least 100 markers. And more data allows our body to provide us with a more accurate feedback of what's going on. Second is the ability and the scope for personalization. Now, this helps us tailor-make the treatment plan for every individual by one, personalizing their nutritional requirement, optimizing their gut health, and prescribing the supplements which are required. And it busts the myth of health looks the same on everyone. The third, prevention. Now, these tests help us in identifying a health trend before it manifests into a disease, thereby allowing us on maintaining optimal level. And the last is a holistic approach. Now, traditional medicine, unfortunately, only focuses on treating isolated symptoms, excuse me, or diseases without considering the interconnectedness nature of our body systems. While the FM approach focuses on a much more holistic view, while with the understanding that the entire body is interconnected. Now, these are some of the investigations that we recommend in our clinical practice. The first one being comprehensive blood panels, which help us in assessing liver function, kidney function, inflammatory markers, and heavy metals, and giving us a general overview of an individual's health. Number two, nutritional testing, which assesses the micronutrient levels in the body, such as important vitamins such as A, D, E, K, and B complex vitamins, and also minerals such as zinc, copper, magnesium, which heavily influence our metabolism. Third is the gut health testing. Now, as we all know that the gut microbiome has a very important role in our digestion, in our immunity, and our overall health. Now, a lot of tests such as organic acid testing and GI mapping help us assess the microbiological composition of our gut. And the last being food sensitivity testing, which identifies any sensitivities or allergies to any specific food. Now, I think in all of our careers, we have had patients who come to us with seemingly normal reports, along with chronic health issues which do not resolve no matter what. Now, picture this, a patient who feels extremely unwell and they're unable to pinpoint as to what is going on with them. They do visit their doctor, who advises standard blood tests and then reports that everything is completely normal and that there's nothing wrong with them physically. Now, when faced with these broad ranges, a practitioner or even a patient might just conclude that because a biomarker falls within the normal limits, there is no disease and there is absolutely no need for treatment. And that can be the biggest mistake.
Dr. Shefali, your slide is empty.
Yeah, I know that.
Yeah. Just confirming on the same. Yeah.
Okay, all right. Yeah. Okay, thank you, Dr. Grishma. Yeah. Now, this is what brings us to optimal ranges. Now, the problem here is that the broad reference ranges are used to analyze reports. They're actually based on averages and not on the actual health. The optimal reference ranges that are used by FM practitioners are much, much narrower than what is used by conventional medicine. So any signs of any kind of dysfunction or pathology can be detected much earlier on using the optimal reference ranges. And also, in contrast to the normal reference ranges used in allopathic medicine, the optimal range actually reflects the optimal health and function rather than the absence of any kind of disease. Now, as we have all encountered in our practice, something which is really common is inflammation, and especially chronic inflammation. Now, this is something which affects each and every person. Now, even though a certain amount of inflammation is important and it is important to fight the infections, it really becomes a problem when it doesn't reduce after the threat is gone and it continues like an out of control wildfire. Now, as we all know, homocysteine has an important role in methylation, which helps us regulate the biochemical pathways of the body and also contributes to a good gut health immune system. Now, impaired methylation can be due to genetic mutation, number one. Number two can be due to lifestyle factors, an inflammatory diet, or a lot of excessive toxin exposure. Now, according to this report, the homocysteine levels are well within the reference range. But the problem here is that the ideal optimal range of homocysteine should be less than 5, which means that in this particular patient's report, there is a lot of inflammation that is going on in the body, which is contributing to autoimmunity. Now, another marker is CRP, which is produced by our liver in cases of systemic inflammation. And according to the standard ranges, this particular patient has an average risk of developing any kind of cardiovascular disease. But in terms of functional medicine, the 1.9, the value here should be at least less than 1, which means that in this particular case, there is a lot of chronic inflammation that is happening. Now, as explained by Siddharthji, we all know that an unhealthy accumulation of heavy metals in our body can disrupt the body's homeostasis. It affects our mitochondrial function. It disrupts our normal cellular metabolism. Now, looking at this particular report, the amount of lead here which has been reported is 145, which is technically well within the limits of 150, which is ideally normal. And only if it is more than 150, it is considered to be high, which would require treatment according to conventional medicine. And this is the same for mercury, aluminium, and selenium. And this, frankly, is one of the biggest flaws of depending on the normal reference ranges. But this now begs the question that what are the optimal functional ranges for heavy metals in our blood? Now, neurotoxins such as lead and aluminium should be ideally less than 10. Mercury should be less than 0.5. And selenium, which actually promotes detoxification and is cytoprotective in nature, should be at least in the range of, say, 250 to 300. Now, coming on to the advanced functional tests that are available in India. The first is the cellular level evaluation of nutrition based on metabolites. Second is the assessment of genetic makeup of microbes by the microbiome assessment, which is the GI map. Assessment of sensitive and specific infections by a metabolite of the infection. And the last is serum and tissue level toxicity analysis. And the first is elemental hair analysis. Now, this is a functional screening test that provides information on the toxic metal exposures and the status of specific nutrient elements. So, what is the need for elemental hair analysis? Now, hair is a very, very powerful tool which is used to evaluate the chemical and the mineral composition of the body. Now, this is because it gives an average of 3 months of history, which is unaffected by the daily dietary intake and the environmental changes. Also, it gives the most reliable results of the body's mineral content compared to the blood test. Now, our body is inherently very smart, and one of the examples of that is now our blood has certain mechanisms in place that equalize the amounts of elements in the serum at the expense of their reserves in the tissues. This means that despite a seemingly correct concentration of elements in the blood, their amount in the body may be insufficient or in excess. And this is because the blood tests only reflects the current levels of heavy metals and it does not give us the actual results at a cellular level. Now, some common indications of heavy metal toxicity are chronic fatigue, autoimmune disease, neurological disorders, brain fog, mental health conditions, ADHD, autism, dementia, and insomnia. Now, in this particular report, which is a report of the hair sample analysis, now we can see that the essential minerals such as potassium, iron, zinc are all reported. But this only assesses the levels which are present in the tissue. This is a report which tells us about the concentration of the heavy metals in our body, such as arsenic, barium, aluminium, cadmium, lead, mercury. And in this, we can see that the amount of toxic metals that are actually deposited in our tissue contribute to a lot of conditions. Number one, such as learning disabilities, chronic fatigue, and also autoimmunity. The second is GI mapping. Now, this is a comprehensive form of stool testing that utilizes qPCR technology to detect gut dysbiosis and gut inflammation. Now, the question is that why do we need GI mapping? Now, this particular test relies exclusively on quantitative polymerase chain reaction, which is the qPCR technology, to detect a lot of bad guys, which are parasites, bacteria, fungi, by targeting the specific DNA of the organisms that are tested. And it is designed to detect the microbes in such a way which are contributing to dysbiosis, number one, number two, chronic inflammation, and an abnormal immune function. Now, as you can see on this report, which is a GI map report, there is significant dysbiosis here, which is affecting the overall health of the patient. On this report, we can see, now if you'll see, we'll have a look here, these are the intestinal health markers. Now, a lot of inflammatory markers, such as calprotectin, are high, and immune risk markers, such as anti-gliadin IgA, and also eosinophil activation protein are high. Now, these are indicative of chronic inflammation, which are due to long-standing infections. Now, these reports help us understand, number one, the kind of bacteria which is causing dysbiosis, number one. Number two, it also helps us in understanding how long and how prolonged is the inflammation, which helps us tailor-make the program and the plan for the particular patient. Now, coming on to organic acid testing. Now, this is a functional metabolic testing which assesses the organic acids, providing an insight into gut health, mitochondrial function, and also neurotransmitter metabolism. Now, the basis for organic acid testing. Now, organic acids are cellular byproducts which are produced through biochemical pathways which are important for our body to function properly. Now, these pathways require sufficient vitamins and minerals to run efficiently. And metabolites can build up when there are insufficiencies or deficiencies in the body. Now, the commensal microbes which are there in our gastrointestinal tract produce organic acids, which are then absorbed into the circulation and are excreted through urine. Organic acids thereby give a snapshot of a person's nutritional status, metabolic efficiency, and also the microbiome balance. Now, on this report, which is an organic acid test report, you can see that the metabolites of fungus and Clostridial bacteria are detected, which helps us in understanding the state of dysbiosis which is occurring, which is ultimately affecting the overall health. This also helps us in understanding as to what infection control must be done for that particular patient. Over here, we can see that the mitochondrial markers and the neurotransmitter metabolism can be understood, which helps us in understanding what supplements or what tools should be given to help the mitochondrial function so that it improves, thereby improving our longevity. So to conclude, functional medicine offers a paradigm shift in clinical practice. It encompasses the genetic uniqueness of each and every person, the importance of therapeutic partnership, and the role of environment and lifestyle in developing and treating the disease. And by striking the right balance between the mind, body, and spirit, the philosophy and practice of functional medicine produces a much more effective response to patients' chronic conditions. And to conclude, if we don't make time for our wellness, we'll be forced to make time for our illness. I would like to thank IAFM for this beautiful opportunity so that for all our participants, and to me as well for giving me this opportunity. Thank you.
Thank you so much, Dr. Shefali, for giving us insightful session on the functional medicine testings. It's important that the organic testings and the GI mapping and everything that we do to understand the root cause analysis, and just starting with the foundation blood workup and then moving on, it's like peeling the onion. So one peel, second peel, third peel, according how the patient wants to go. As it's truly said, it's a patient centric, how far the patient really wants to go in understanding what the root cause could be, right? But definitely we get an idea from the normal blood workup as well. There are certain questions though in the chat box that I'd like to ask you. What are your views on quantum magnetic analyzer test, if you have any idea on the same?
I do not have an idea on this.
Yeah, so we'll definitely...
I will definitely look into it.
Yeah, yeah, we'll give you a reply on the same in the community group as well. The functional, Dr. Sandeep has asked this question. Functional optimal level, as you were talking about lead, mercury, cadmium, the metal toxicities. What is the functional optimum level of lead, mercury, cadmium, and selenium is what his question is.
So let's understand this. Now, ideally, metals like lead, cadmium, these are all neurotoxic. They should not be there in our blood. Now, as mentioned by a lot of our previous speakers, that unfortunately we live in an environment where we are exposed to heavy metals on a daily basis. Now, ideally, the levels of lead, as I had mentioned, should be at least less than 10. What we want is to be less than 5, but that would not be possible, right? Okay. So it should at least be less than 10. Now, selenium is a very important micronutrient. The first thing it should be is that it should be at least from 250 to 300. That is the first thing. Right?
By chance, is there any toxicity of selenium that you look in patients of Hashimoto's or thyroid conditions? Because selenium is also a very important micronutrient when it comes to managing thyroid patients. Do you see any cutoff value for the same as well?
So, in my experience, I have not seen anyone yet who does have thyroid and have selenium toxicity. Unfortunately, they are all very low on selenium. That's because the thing is that selenium is not there in a lot of food sources. We have our egg yolks, we have our Brazil nuts and all of these things. But these things are generally not consumed a lot. So that's the reason that, when we do make the plan, we have to focus on all the optimal values which are important.
Yes. What's your take on, because India is the, it's known as the anemic capital when it comes to anemia. What is the percentage of hemoglobin that you would like to see in a normal female and a male? What is the normal percentage that an optimal functional medicine practitioner or a health coach would see?
So generally, when we do look at the blood reports, or especially, what we have studied during our days of medicine, what we generally see is that a value of 10 to 14 is, recommended by the books and in the labs. But we generally want a value of, say, 12.5 to 13 at least. This is for a
Yes,
female.
that's for a
Yes,
female,
that is
and
for
that's
a female.
important. Yeah, because
Yes.
people consider that I've seen a lot of women taking my grandmother also into consideration. They were very happy when the value used to come 11 and 10. They were happy with
Yes.
the same that
Yes.
that we have
That
increased
we're in
from
the safe zone and
yeah,
everything's
we are in
okay.
the safe zone.
That's
Yeah,
true.
but that's not the thing. And in case of a male, what would you
So in
say?
the case of male, what we have seen is generally from 13 to 16. So anywhere between 14 to 15 should be the ideal range.
Yeah. And also keeping the hemoglobin, because every parameter needs a check, the hemoglobin, ferritin, and the entire iron
Everything is
profile
important.
before everything
Everything
is
is
important
important.
before
Yes.
prescribing any medication
Yes.
or supplementation for the same.
Yes.
What's your take on the normal values of vitamin D? And that's a very common question that is asked. What's your take on that?
So let's understand something when I say insufficiency and deficiency. Now, something which is on the scale of 0 to 10. 1 is also on that scale, but that is actually insufficient. And something which is 0 is deficient. Now, we want an optimal range, which should be somewhere, say, 0.7, 0.5 to 8.
Yes.
Now, the ideal value of vitamin D should be at least 75 to 80, at least. That is
Yeah.
the minimum it should be there. And unfortunately, even we're a tropical country, but I would say at least 95% of the Indians were all deficient in vitamin D. Because ideally, they're all within the normal limits. As you had mentioned about iron, they're all in the normal
Yeah.
limits.
They feel
And we
that they are
don't
in the
realize
normal
that we're
limits.
deficient.
Yeah.
Exactly.
They
So
feel
that's
that they
the
are in the
thing.
normal limits.
So from
Yes.
0 to 10, we have to understand where are the important values and how do they actually affect our health. That's the biggest thing here.
Okay. One more question I'd like to take is, I actually saw a good question. Uh, what would you suggest in terms of when you're going for the blood workup, right? Uh, any kind of a blood workup that you're going, do you require fasting if somebody is taking a thyroid medication, as we all know as practitioners as well, but could you put a light on that?
So fasting is advised, and overnight fasting for at least 10 to 12 hours. That's the first
Yeah.
thing, right? And it's also that you should not take your thyroid medication before your blood test is done. That's another thing. Also, if you are going for your blood test, the basic blood panel is something which all doctors do prescribe to their patients. But apart from that, you should actually look at the nitty gritties, which I had mentioned. One is homocysteine, hsCRP,
Yes.
right? If in any case you do feel that your hemoglobin is low from a prolonged period of time, you should actually consider getting your iron profile checked, because that is very important, and that would actually give us a better picture of what's going on and why your hemoglobin is just stuck at that say 10.9. So
Okay.
that is something which should be considered.
Thank you so much, Dr. Shefali,
Thank you, Dr. Karishma.
telling the entire conference and people, the attendees and the practitioners. Practitioners definitely know about it. The attendees, that the normal value that you consider may not be normal, and you might keep, you'll be happy with the results that come out, but those are not your actual results. Okay. Thank you so much for joining us and giving your
Thank you,
insightful
Dr. Karishma.
views on the same. Thank you.